There's a drug right now that isn't approved. No prescription for it exists. No pharmacies carry it. And people are already injecting it at home from a vial they bought online. It's called Retatrutide. For some of you, that's the first time you've heard that word. For others, already familiar with Retatrutide from forum threads, TikTok, YouTube, and other social media platforms, are trying to decide, do I buy it or not? Many have read the trial numbers and are aware of what this drug can do. If the molecule is proven, who's ever shipping it must be fine too. Going backwards or reverse engineering this, the trial data is real. The vial or source you want to buy from was never in that trial. 6 people in Australia are in the hospital right now with liver injury from vials labeled Retatrutide. Their own health department won't blame the drug. They're blaming what's inside the bottle. 5 truths about Retatrutide. I'm Dr. Lee and I read all of it. The Australian alert, the trial results, every warning letter the FDA has sent. Number 4 is what's actually in those, and number 5 is the mass of waiting. That's the one that changes what you do tomorrow morning. But first, the basics, because this whole family works the same basic way. GLP-1 is a hormone your gut already makes every time you eat. It tells your brain you're full. It slows your stomach down so food sits longer and that fullness lasts. And it helps your body handle food sugar. Every drug in this family, Ozempic, Zepbound, now Retatrutide, just gives you more of that same signal on a schedule. Instead of fading it out 20 minutes after you eat, it tells your brain you're full. It slows your stomach down so food sits longer and that fullness lasts. And it helps your body handle food sugar. Every drug in this family, Ozempic, Zepbound, now Retatrutide, just gives you more of that same signal on a schedule. Instead of fading it out 20 minutes after you eat the way it does naturally, that's why people lose weight on these medications. Turn up a signal your body already makes and the noise around food gets quiet. Now the differences. Semaglutide, Ozempic, Wegovy works on one hormone receptor, GLP-1. Tirzepatide, Mounjaro, Zepbound works on 2, GLP-1 plus GIP. Retatrutide works on 3, GLP-1, GIP, and a glucagon receptor. That's not a small step up. That's the most receptors we have ever put into one weekly shot. And that third one is the headline. The glucagon piece doesn't just quiet your appetite, it turns up the amount of energy your body burns. Appetite down, energy burn up. That's why weight loss numbers in the trials are bigger. That's why this drug is the one everybody's talking about. So no, this is not hype. I'm not going to pretend the science isn't impressive. It is. It's some of the most exciting weight loss science I have seen in my career. That's why exactly you deserve the whole story, not just the exciting part. And real quick, if this is already helping you, do me a favor and hit subscribe. I put one of these out every week. All right, back to it. Let me tell you what's happening in my clinic right now. Almost every week, somebody asks me some version of the same question. Dr. Lee, should I just wait for Retatrutide? They've seen the headlines, the triple G, the king of the GLP-1s. And I get it. And I remember 2021 when semaglutide was the shiny new thing, and then tirzepatide after that. There's always a next big thing coming. Always. But here's the part that keeps me up at night. A patient sat across from me not long ago and told me, a little embarrassed, that they have already bought Retatrutide online. A little vial from a website labeled for research purpose only. No prescription, no doctor, no pharmacy. And I had to tell them the truth. I don't know what's in that vial, and neither do they say. Nobody checked it. And look, I take tirzepatide myself. I'm the last person who's going to tell you those medications don't work. They changed my life. That's exactly why I care about this one being done right. Number 2, in the phase 2 trial, people on the highest dose studied lost about 24% of their body weight in under a year. Then the phase 3 trial came in. 2,300 people, 8 weeks, highest dose, and it depends entirely on how you count. If you measure only the people who stayed on the drug and took it as directed, about 28%. If you measure everybody who started, including the people who quit or cut back or couldn't tolerate it, 25%, because everybody who started is the group you would actually be in. And here's what nobody's posting about this will tell you, that the phase 3 results is a press release, not a published paper. Nobody outside the company has reviewed it. I'm telling you the number, and I'm telling you where the number came from. Now, you've probably seen 30% everywhere. Here's where that came from. A slice of that trial, about 500 people, the ones who started at the highest body weights, followed another 6 months. That group went past 30. That's a subgroup in an extension. It's not what the trial found. It is not what most people got. We have never seen numbers like these from a medication. That part is true. The excitement earned. But numbers from a trial are not the same thing as a medicine you can pick up at a pharmacy. Truth number 3. And I need you to really hear this one. I cannot prescribe it. And here's the part almost nobody understands. In the early days of semaglutide and tirzepatide, those drugs went on the FDA shortage list, and compounding pharmacies were allowed to make versions of them. People assume the same door is open here. It is not. That rule only works for a drug that's already been approved. Retatrutide has never been approved for anything. There's no official recipe for it. No monograph. It isn't on the list of ingredients compounding pharmacies are permitted to use. So there is no legal version. Not at a compounding pharmacy, not at a med spa, not at a telehealth site. None. So if a website is selling you Retatrutide today, whatever is in that vial is not a regulated medication. The realistic timeline, I'm not going to guess at when the company files, because the company hasn't said. The people who forecast this for a living put the earliest pharmacy shelf around 2028. That's an analyst's estimate, not a promise, and not the company's. The honest answer to when can I get it? Which brings me to truth number 4. Go back to those 6 people in Australia. Acute liver injury. Their liver enzymes through the roof. Bilirubin up. Blood not clotting the way it should. Jaundice, the yellowing you can see in someone's eyes. They were injecting vials labeled Retatrutide, and here's the sentence from that health department that I want you to sit with. They said the toxicity was possibly associated with a contaminant, not the drug, something else that was in there. Now think about what that does to the reasoning you started with. You looked at the trial data, the good trial data, the real trial data, and you concluded the vial was safe. But the trial data describes a molecule made in a regulated facility, tested, measured, put in a sealed pen vial. The trial data tells you nothing about what is in the bottle you bought. The better the science gets, the more convincing the bottle looks. That's not a coincidence. That's the whole business model. And this isn't one health department in one country. After taking peptides, they bought this way. There's a case report in the medical literature, a real reviewed one, of a person with diarrhea so severe and so relentless it wouldn't stop. From a vial they ordered online. The FDA has sent 14 warning letters to these sellers since 2024. As a couple of months ago, 11 of those companies were still advertising. 8 of them were still selling. A warning letter is a piece of paper. It does not close a website. And I want to be careful here, because there's a lot of noise about what's in these vials. You'll see people quoting very specific percentages. How many were contaminated? How many had the wrong sequence? I'm not going to repeat those, because when I went looking for the study behind them, several of the websites publishing those numbers also sell peptides. Here's what's actually true, and it's worse. Nobody has done a rigorous published analysis of what is in those vials. Nobody. So when I tell you I don't know what's in it, I'm not being dramatic. I'm telling you the state of human knowledge. Neither does the seller. And there's another layer to this almost nobody talks about. A lot of these vials don't come ready to inject. They come as powder, and you are the one who has to mix it at your kitchen counter. Not in a sterile pharmacy hood, not with a verified sterile water, not under any controlled process at all. That's one more place for something to go wrong. On top of everything already unknown about what's in that vial, a real pharmacy reconstitutes medication in a sterile controlled environment. Checked, verified, accountable. You, at home, guessing. That's not a medication. That's a science experiment you're injecting into your own body. There is no doctor on the other end of that website. That's the whole problem in one sentence. And even if those vials were perfect, Retatrutide isn't a stronger tirzepatide with the same manual. In the phase 3 trial, at the highest dose, people stopped the drug because of the side effects. On placebo, about 5%, more than twice as many. That is not a small number. That's 1 in 9 people who could not stay on it. And it caused something tirzepatide doesn't. A strange skin tingling and sensitivity called dysesthesia. 12.5% of people at the highest dose, under 1% on placebo. You may have heard Retatrutide raises it. In the phase 2 trial, it did, about 7 beats a minute. The phase 3 results don't report heart rate at all. And what phase 3 says about the liver and the kidney is nothing. It hasn't been reported. Sit with that for a second. The people injecting this in their bathroom are taking a drug whose effect on the liver at scale nobody has published. In the trials, every one of those people had a medical team watching them. The person injecting a mystery vial has nobody. So here's truth number 5, the decision itself. Should you wait for it? Let's do the honest math. Best case, Retatrutide is roughly 1.5 to 2 years away. Now, what does waiting cost? The medication we have today, semaglutide, tirzepatide, are the 2 most effective weight loss medications ever approved. Tirzepatide trials showed people losing around 1/5 of their body weight, 25% plus. And before you put that next to Retatrutide's number, understand what you're doing. Those are 2 different trials. Different people, different sites, different years. Retatrutide has never been tested against tirzepatide, not once. That head-to-head trial exists. It's running and it has not reported. So anybody showing you Retatrutide versus tirzepatide side by side today, including me 5 seconds ago, is comparing 2 things that were never in the same room. But here's what we can say for certain. Tirzepatide is available now, legally, with a real prescription, real pharmacies, and a real doctor watching your labs. So picture 2 versions of you 2 years from now. Version 1 waited for the perfect drug and spent 2 more years carrying the weight, the blood pressure, the joint pain, the pre-diabetes. Version 2 started on what's proven and available today and walks into 2028, 2 years into the work. Evaluated, monitored with a doctor who knows your labs. Because here's the thing nobody tells you. Starting out doesn't close the Retatrutide door. If it's approved and it makes sense for you, switching medications later with your doctor is normal, routine thing we do. You lose nothing by starting now. You lose 2 years by waiting. The perfect drug you can't get doesn't beat the excellent drug you can. And here's something I'll tell you honestly. From actually prescribing those medications for years, semaglutide, tirzepatide already works incredibly well for the vast majority of people. You don't need 3 receptors to lose real significant weight. Most people don't. I've had patients who found their own way to Retatrutide. However, they got it. And you know what happens. More than a few of them come back to me asking to go back to semaglutide or tirzepatide because the molecule was never the whole problem. If one of today's medication isn't working the way you hope, more often than not, the honest answer isn't you need a stronger drug. It's that the lifestyle and the mindset underneath it haven't been dialed in yet. And that's just as much a part of this as what's in the syringe. That's actually a whole video by itself. And it's a big part of what we work on inside my membership. The coaching and guidance side of this, not just a prescription. And figuring out which of today's options fits your body, your history, your labs. That isn't something you should have to figure out alone, which is the whole reason I built what I'll point to you at the end. Hold that thought. Let me make it real. I had a patient. She'd read every Retatrutide headline and she told me flat out, I'm going to wait for the good one. We talked through exactly what I just showed you. She started tirzepatide instead. That was months ago. And you know what she told me at her last visit? I can't believe I almost waited 2 years for this. And the patient with the online vial, they stopped. We got them properly evaluated and they're now working on this with a real prescription with somebody actually watching their labs. Both of those are wins. Neither one of them is waiting. So here's where I land. Retatrutide is coming. It's real. And when it's approved, you'd better believe I'll make a full video on it. but your health doesn't have a pause button. And getting started the right way with the medications that are proven and legal today is where people get lost or get scammed. Not here. That's what my practice is built for. So if you're trying to figure out your safest next step, the link in my description has more information and how to get started. It'll show you your safest next step. And if you're on Instagram, comment GLP1, that's GLP1, on any of my posts at GLP1 Dr. Lee, and I'll get you pointed the right way. Do me a favor, drop a comment and tell me, would you wait for Retatrutide or start now? I read everyone. And hit subscribe. Next up, I'm covering semaglutide versus tirzepatide. Which one is actually right for you? Because they are not the same medication. You do not want to miss that one. I'm Dr. Lee. I'll see you in the next one.